In this video, we will be discussing about left ventricular hypertrophy. As we have already discussed in previous videos where to look at, so you need to look at V1 and V6, and we have already discussed that suppose if this is isoelectric line, in normal case the B1 will have negative QRS complex whereas B6 will have positive QRS complex. So the reason why we get such uh, uh, ECG changes you can see in the previous videos. And now in case of uh, left ventricular hypertrophy, you will be finding the same features that you see as in normal. However, the changes will be of greater magnitude. So suppose in B1 you will see the negative QRS complex a bit greater in magnitude, and in V6 the positive deflection will be seen a bit greater in magnitude. So these findings you can find. So you see here this is the V6, so you see how tall is the positive deflection here. So you see, whereas in B1, so you see that the S wave is so negative. So this gives one clue that it might be left ventricular hypertrophy. Now from the axis also you can determine whether it is right axis deviated or left axis deviated. In case of left ventricular hypertrophy, there will be left axis deviation. So for that, what I will do is I will draw lead 1 here. I will draw a straight line. So this will be our lead 1 representation. Okay. So this is lead 1, and I will draw another. This is lead AVF. So now I will draw the vector representation in upon them. So you see here in lead 1, you see the QRS complex is positive. So the vector representation will be uh, positive in lead 1. So here it is positive, isn't it? So here this is going in positive direction towards lead 1. But in case of AVF, you see here this is AVF. So this is AVF, you see the QRS it is negative. So you see the in case of AVF the QRS complex is negative. So when we draw that vectorial representation, so negative means it is going so upward. So when it is going upward, so this is the representation of QRS depolarization in lead AVF because it is negative deflected, so it is going in opposite direction. And when you draw imaginary perpendicular line, so I draw from here to here a imaginary perpendicular line, and from here to here, and when I take the resultant, then I take the resultant vector. So this will be the resultant vector here. So you see this resultant vector is making greater than minus 30-degree angle. So you see here, so this resultant vector is in this direction, and it is of course indicating that it is left axis deviated. So it is supporting towards our finding that it is left ventricular hypertrophy. So you see in left ventricular hypertrophy in B1 you will have negative deflection which is more prominent. In V2 also you will be having negative deflection, whereas in V6, whereas in V5, that are the lateral leads. In lateral leads you will be finding positive deflection. And sometimes if there is left atrial enlargement associated with left ventricular hypertrophy, then you can look at lead 2. In lead 2, in case of left atrial enlargement, you will be finding like P mitral, so double peaked P wave will be seen. However, in this case it is not clear, so left atrial enlargement has not been progressed. So this is the case of left ventricular hypertrophy with left axis deviation. This finding you can find from here. And a quick assessment of finding the rate. So okay, from here I am taking you see here, so from here, so the greater square box it is 300, and till here it becomes 150, till here it becomes 100, until here it becomes 75. So it is around 75, but you see that it is not regular. You see here 1 2 3 4, but in case here 1 2 3 4 5 6, again 1 2 3 4 5. So the rhythm is not regular in this case, so that formula you cannot mention. So you need to have another formula to calculate the rate in this case. So what will be the formula to calculate the rate will be your homework. In next video we will be discussing about rate, rhythm and normal sinus rhythm. One clue I would like to give is that there are different methods to find the rate. One is 300, 150, 100, and gradually that small square box you can go. Another is 500 divided by number of small square box between two R wave or two peak waves. So that also you can apply. But this is irregular case, so irregular rhythm. So you need to apply another formula. So that would be your homework. So again summarizing, this is the case of right ventricular hypertrophy with right axis deviation. Thank you.